I'm Shawn Whiteman. I'm a professor of human development and family studies and the associate dean for research in the Emma Eccles-Jones College of Education and Human Services. In the fields of developmental psychology and family science, research on sibling relationships has lagged behind other close relationships. In fact, a recent analysis revealed that less than 3% of the literature on close relationships is about siblings. This gap in knowledge is surprising given that more than 80% of youth in the United States grow up with a sibling in their home. What is particularly surprising about this neglect is that it generally flies in the face of the popular press. In fact, sibling relationships are prime topics for magazines, books, and other popular press sources. So, sibling relationships are important because they're the longest lasting family relationship we'll have. As I said earlier, most youth in the United States grow up with siblings. And in Utah, we're especially likely to have siblings. We have the largest family size in the country. So youth in Utah are more likely to reside in homes with multiple siblings, and brothers and sisters, both older and younger, shape development. In this Blue Plate Research talk, I will talk about the various ways in which brothers and sisters shape each other's behaviors, as well as shape their parents' expectations and attitudes, how a sibling can increase or decrease an adolescent's likelihood of engaging in risky substance use like alcohol and marijuana, and how my research can be used to develop interventions and prevention programs to support healthy sibling relationships and promote healthy decision making. But before we get to these points, I'm going to provide you with a personal anecdote that led me to how I'm talking with you today. This is how my sister shaped my development. My sister and I are 22 months apart in age, but we were always one grade apart in school. This was because of the way our birthdays fell around the school cutoffs. Growing up, my sister and I were similarly academically adept, but I'll admit I did not work terribly hard in high school. When my sister returned home from her first year in college, we learned that she was not invited back for her second year. My naive read of the situation at the time was, college must be really hard because my bright and capable sister did not do well. After dealing with the fallout of that summer, including some really difficult, intense family relationships, I went to college motivated to do well. I studied and prepared for the classes in the first time of my life, and I performed well. Professors recognized my efforts and performance and encouraged me to get involved in research. This led me to a path to pursuing a graduate degree with their encouragement, something that I didn't know was an option at the time. My sister's experience was indirect, but a critical factor that led me to a career in research and motivated some of my interest in studying sibling relationships today. One of the ways that siblings can influence each other is through their indirect effect on the family and family system. Siblings provide one another with sources of social comparison by which they can compare their achievements, abilities, and the ways they're treated by their parents. Another way that siblings influence each other is through their indirect influence on the family and their parents. For example, one line of my work examines how older siblings shape parents' expectations and parenting behaviors of their younger siblings. In short, across these studies, we found that parents who had already parented an adolescent, that is an older sibling, had more optimistic and realistic expectations about their younger children's teenage years. Further, we found that parents reported less conflict with their younger children and had more knowledge of their everyday activities as compared to the older siblings when they were measured at the same age. Taking advantage of our longitudinal studies where we study families over time, we're able to compare parents' experiences with multiple children when they're the same age. For example, in year 1, we could study the experiences with John, who was 13, and 2 years later, we could study the experiences with his younger sibling, Jim, who was 11 in year 1, but now 13 in year 3. And by doing these types of comparisons, we can show what parents' relationships are like with their kids when they're the same chronological age. And across these studies, we've found that parents have generally more positive relationships with younger siblings when they're the same age, meaning they have less conflict and they have more knowledge about those younger children's activities and school performance. Another line of my work looks at whether the presence or absence of a sibling affects family dynamics. Most often, this type of work is studied when a newborn is introduced into the family home. In my work, taking advantage of our longitudinal studies with adolescents, we study the opposite. What happens when an older sibling leaves the family home for the first time, and what happens to the family dynamics for those who remain home? In one study, we found that following an older sibling's departure, parent-child conflict actually increased for the child who remained home. Why? Well, here are some quotes from those children. She's been paying more attention to me. Schoolwork, what I'm doing. It's kind of odd to be under the more watching eye. Yeah, more of the focus has shifted to me. I think there's more attention from my parents, which is sometimes a good thing and sometimes a bad thing. Well, they talk to me more about school, running, sports, and friends and things. It seems like they're into my life. In the psychological and sociological literatures on family size, there's a hypothesis called the resource dilution hypothesis. This hypothesis states as family size increases, parental capital is spread more thinly across those children. In the present example, we propose the inverse. As the number of children in the family shrinks, parental capital is freed to be reallocated across those remaining siblings. In fact, in another study, my colleagues and I, we found that younger siblings' receipt of attention and companionship, time spent with parents, increased, as did their receipt of privileges and material goods. Many of these changes were associated with positive changes in their adjustment, such as increased GPA. Another way that siblings influence one another is through their direct interactions with each other. Research reveals that in childhood and early adolescence, siblings spend more time with each other than any other relational partner outside of school hours. It is in these settings that children learn, practice, and engage in behaviors with their brothers and sisters. In addition to serving as companions, social partners, and playmates, siblings can also serve as models, advisors, or even foils for one another during adolescence. It is in these two areas that my current work on sibling influences on adolescents' alcohol and other substance use behaviors is focused. Funded by the National Institutes of Health, we're working to identify the various ways in which siblings shape each other's substance use behaviors in adolescence and beyond. To do this work, we recruit families with multiple adolescent siblings from across the nation. For the most part, we interview family members over the phone or via surveys over the internet, and we follow them for a number of years, which is called a longitudinal study. Now, it's important to note that most research on siblings and sibling relationships focuses only on one dyad. And in most cases, that's focusing on a dyad of consecutively born siblings or those that are closest together in age. Clearly, studying one dyad does not represent all possible dyads and all possible sibling influences within a family, but this is done largely for methodological reasons. For example, it would be very difficult and take a long time and require multiple methodologies to study the 36 different sibling dyads that existed amongst the 9 Osmond children when they were growing up. In our research on teen substance use, including alcohol and marijuana, we found that younger siblings are more than twice as likely to engage in alcohol and marijuana use if their older brother or sister has engaged in those same behaviors in the past year. Importantly, this effect of siblings is unique, above and beyond the influence of parents and peers, and the size of the effect is greater than that of the size of parents and on a par with peers who are considered normally the most important influence on adolescent substance use behaviors. We further found that similarity in sibling substance use is especially likely when younger siblings report looking up to or wanting to be like their older sibling, or perhaps modeling them. In contrast, when younger siblings reported wanting to be different or trying to be different from their older siblings, there was no association between the older siblings' substance use behaviors and their subsequent behaviors. How do older siblings influence younger siblings' substance use behaviors beyond serving as models? Another set of studies shows that older siblings are key in shaping younger siblings' expectations about substances. For example, having an older sibling who drinks alcohol is associated with younger siblings having more positive expectations about alcohol, that they think alcohol will be fun and provide more social opportunities. Those expectancies in turn are associated with a greater likelihood of use. Another way that siblings shape each other's health risk behaviors is by introducing their brothers and sisters to the settings and companions in which those activities occur. We found that older siblings are critical sources who provide access to substances and substance-using peers, which again is positively related to teens' alcohol and other substance use. The COVID-19 pandemic is an especially interesting time to study sibling influences. Following the abrupt closures to schools and other societal institutions like sports teams, siblings were spending more time at home with each other with limited in-person interactions with peers. Because adolescents typically consume alcohol with peers and access to peers was greatly limited during COVID-19, at least in-person access, it's possible that siblings may become especially important in shaping each other's drinking behaviors. In new research that's currently under review, we found that sibling influences were indeed elevated. In recently published work, we also found that nearly 1 in 6 parents newly allowed their adolescent children to drink alcohol in the family home during the COVID-19 pandemic. Importantly, parents were equally likely to let their older and younger children drink alcohol during this time. Although this may not seem like a sibling effect, it is likely the result of parents not wanting to treat their children differently. And it has the side effect of introducing their younger children to alcohol at an earlier age, which is related to greater substance use problems over time. Throughout this presentation, hopefully I've convinced you that siblings uniquely shape each other's development, relationships, and health. This is important because siblings provide an important and unique context for intervention and prevention efforts aimed at promoting health and reducing substance use. Family relationship education programs and intervention programs focused on sibling relationships, however, provide a non-threatening entry point into family development and substance use prevention. So the findings from our research can be used to develop relationship education programming and intervention programming to help families improve sibling relationships and ultimately mitigate adolescent health risk behaviors. These programs will benefit parents by reducing conflict in the home, promoting more harmonious relationships, and ultimately providing a more supportive family environment.